In this lesson, we're going to take a look at different types of exercise for your patients. I'm really excited to go over this lesson. This is one of my favorite topics, both as a nurse and personally. When we talk about exercise, I want you to think about exercise and the patient, not just exercise as a whole. We need to work on catering our care to our patient's needs. So when we think of all of the different exercises we can do, we can think about them, but just make sure that we're focusing on this. What I want to do is look at the benefits of exercise, because this is the information that you're going to pass on to your patients in the form of like education. Exercise solidly supports heart and lung improvement. It improves things like decreasing blood pressure. It improves cardiac function. It also improves lung performance. It also works on making your patients more endurant to exercise. What we also want to focus on is that exercise not only works on strengths, but also increases mobility. It also helps to improve the supportive tissue around muscles and joints, and it also works to burn fat. Some really interesting information about exercise is that it works on cognitive function, meaning that it can do things like improve mood. It can decrease depression. It works on improving neurodegenerative diseases like Parkinson's disease. It also helps improve sleep. But these are all the benefits of exercise. So now that we've looked at the benefits of exercise, let's look into some mechanics of exercise. And when we talk about mechanics, what we're talking about is body motion. So we're looking at how a particular body part moves or range of motion. And in this lesson, we're going to talk about passive range of motion and active range of motion. With passive range of motion, it's done by the provider. So think about a patient that's had like recent knee surgery. The physical therapist comes in and works on bending the knee through all the angles, and it works to help improve mobility, and also works on decreasing swelling. So if you have patients with chronic issues like maybe edema, this will really help to improve their swelling. Active range of motion is done by the patient. The way I want you to remember this is it works on activating the muscles through use. The benefits of it are that it builds strength, but it is more challenging for the patient. So you're going to see this more of like in a rehab setting after surgery. So let's say your patient has knee surgery, PT runs through your passive range of motion with them. And then once they're discharged to like a rehab for rehabilitation, that's where you're going to get into more of this active range of motion, engaging the muscles through use. Now that we've covered range of motion, let's look on how we build on those with different types of exercise. The first thing we're going to look at is isotonic versus isometric. And when we're talking about, these are just different types of exercise types. So your isotonic is what you're going to think of when you're thinking of exercise, something like a bicep curl. You have a movement through the range of motion. So through each contraction, you go up and then back down, and you have resistance throughout the entire movement. That is what an isotonic exercise is. Isometric is this guy over here. It's contraction through a single exercise with no range of motion. So this is going to be yoga, your static stretching. But the thing that you need to remember is that isotonic works through the entire range of motion. Isometric focuses on a singular contraction with no range of motion. Another example of this, of an isometric, would be something like Kegels. So if you have a patient that needs to work on strengthening the pelvic floor, this is a great exercise for it. The other thing that we're going to look on with exercise types is aerobic versus anaerobic exercise. These two really deal with the presence of oxygen throughout an exercise. Your aerobic exercises are going to be things like running or jogging. These are done over long durations of time, and it has to do with, at least the metabolic level, that the body needs oxygen in order to perform the contractions and for energy use. With anaerobic exercises, they're short duration exercises. So think weightlifting or sprinting. These are done really short, and your body doesn't need the vast amounts of oxygen in order to perform those exercise. Both of these do really well in terms of increasing strength and burning fat. But the thing that I really want you to take home here is to see how each of these different types of exercises, both isotonic and isometric, and then your anaerobic versus your anaerobic, and how they fit into your patient's plan of care. So now let's look at other things you need to consider. The first thing you need to do is understand how your patient views exercise. Do they want to learn? Are they willing to learn? What do they know about it? They may think that when they exercise, they need to look like Arnold, which is not true at all. Using the incentive spirometer, like after surgery, is considered an exercise. So what you need to do as the nurse is you need to make sure that you're dispelling any myths or rumors. You need to get rid of these ideas that exercise is about looking like this guy right here. The other thing you want to think about is how well will your patient do with exercise? How tolerant are they? If your patient's in heart failure and they have blood pressure issues, don't expect to throw them on a treadmill at like 10 miles an hour because they won't be able to tolerate it. Your physical therapists are going to push your patient's limits. They're going to really, really encourage their rehabilitation, but they're not going to torture them, even though they may feel like it. But the thing that you need to remember is that you want to consider their illness or injury or disease when you're planning out their care in terms of their exercise, and see how well they're going to tolerate it. And like when we were talking about a physical therapist and occupational therapist, they do a really, really good job. They work hard to create their own care plans. And so what you need to do is reinforce these care plans with your patient by following either the physical therapist or the occupational therapist guidelines. The other thing is, if you're unsure of how your patient should be performing them, go grab PT, go grab OT, pull them back to the room and say, hey, can you instruct the patient again? I'm also a little bit unfamiliar with what they should be doing, so I want to learn with them. And then you can use that opportunity to educate yourself, and so that you make sure that your patient's properly performing the exercises. Today, as we've talked about exercises, we really focused on health promotion and mobility, and also with safety, because we want to make sure that they're safe when they're exercise by making sure they're tolerant of the exercise that we're getting them to do. So let's recap. Remember, we want to focus on all of the benefits of exercise. So you've got heart and lung, you've got improvements in cognition, also with strength and mobility. Don't forget about your range of motion. Passive is by the provider and active is by the patient. When we're trying to figure out what exercises we need for a patient, can they handle aerobic versus anaerobic? Aerobic is with oxygen, anaerobic is without. So that's what you need to know about that. In terms of education, find your patient's knowledge base, educate your patient, dispel any myths or rumors about exercise, and fill in the gaps. Lastly, understand your patient's level of tolerance and make sure that you're using nursing judgment to encourage them through the appropriate exercises, and then find your PT and OT and use them if you need to. That's it for our lesson on exercise. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.